You're watching CTOM TV. Knowledge is power.
Oh, a nice general question here. Back to general questions, which have great value. What is chemotherapy?
Good question. Typically, chemotherapy is broken down into classes of drugs. Three different classes are platinum agents. Platinum is an element that's used in catalytic converters. And so there's
What's a catalytic converter?
Of a car.
Of a car. Okay.
Muffler
For
of
the
a
car
car,
folks out there.
It absorbs a lot of hydrogen.
Okay.
Or hydrocarbons. And then you have alkylating agents that add a methyl group to the DNA. And then you have what we call antimetabolites. And so these drugs, typically what they do is they interfere with rapidly reproducing cells. And so if a cancer is growing really fast, it's going to have a great effect on it.
So there's three different main types of chemotherapy.
Yeah, basically that's
okay, the platinums, the alkylating agents, and the antimetabolites.
Yes.
But essentially they all work on targeting all rapidly reproducing cells.
In the body. Yeah.
Okay.
It'd be nice if they're selective for just cancer cells, but they're not. And that's the problem. That's why you have so many side effects. They also don't address slow-growing cancers as well. They don't target the stem cells that cause the cancers, because a lot of times they're not reproducing. And they only stay in the body for a short period of time. So, I mean, if you could have a chemotherapy drug that stayed in the body for a long, long time, it would have a much greater effect on the stem cells, because at some point in time, that stem cell is going to turn on and start reproducing the cancers. And then, the chemotherapy drug would affect it.
But the fundamental point you're making is because those drugs aren't targeted to certain mutations and they hit all rapidly reproducing cells, that's why patients getting chemotherapy experience so many side effects, because our hair and our skin cells and so many other things are coming from those rapidly reproducing cells as well.
Exactly.
So that's why, as you were saying, if you can use chemotherapy, but also add the targeted and the immunotherapy, once you know what genes are causing your cancer, and you can have that combination, you can use a lot less of the chemotherapy for far greater results.
Exactly. Yes. So it definitely does still have a role, but the role is as a part of the program, not as a sole treatment.
Right, yes, because it's far more successful when you can do that targeting and, again, lower side effects.
Exactly.
Thank you for watching CTOM TV. Subscribe below and stay informed.